Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. 16 after 9 o'clock. Welcome to News and Views on Salam Media. Also, a big welcome to our Polokwane listeners on One Nation FM. Next, we are going to get reaction to the Parliament passing the NHI bill. Our guest is Ismail van Wyk, Ward 68 Riverlea community activist. Now, the Health Minister Joe Pahla says the adoption of the National Health Insurance Bill was to stop two trains traveling on parallel tracks heading for a crash. But he goes on to say the situation can be rescued if they can be pulled together so that they complement each other. I don't agree with him, but be that as it may, my personal thoughts. Let's hear what other people have to say about this. Ismail van Wyk, Assalamu alaikum, welcome to the program.
Thank you. Thank you much. Thank you very much, and thank you to your listeners today. Okay. Let's start with let's call us a spade in this instance. Um, it's a kick from a dying horse. We all know next year's elections, and the ANC is going to pull out every stop to try and convince people to vote for them again. So this NHI bill is just one of those deploys from the ANC, whereby they have realized they failed us, and they're going to try and put the empty promises back into the bucket again.
I'm wondering, and I think you hit the nail on the head by suggesting that this is just an election promise to get the masses to vote for them, because we do know that. For example, the Freedom Front Plus has threatened the government with action if the bill is signed into law. The DA has said that it would be very difficult to implement the NHI because, as we all know, in the UK, their NHS system is already buckling under pressure with a backlog of 7.6 million people on the waiting list for hospital services. And that is a first world country. And they've had the NHS running forever and a day in their country. How does this uh, corrupt government believe that they can actually introduce this bill and make it workable?
Um, let's start at the beginning. The ANC government, corrupt ANC government, is stating clearly with the 9 million people employed, that there's an insurance scheme, right? They are saying they will basically put in the amount that is needed within this country. As you've just said, a first world country is buckling. So just imagine 9 people on medical aid scheme and look at our unemployment rate. I think it's just one of those ploys of the ANC whereby they are saying we are going to introduce this. It's elections, as I said, but we all know we're heading for failure. It's exactly the two trains heading for a head-on collision. So, as South Africans, I think the NCA is passed, right? It's a 8.8 billion rand within the next 3 years. The government is saying they will basically pump into the system. But we all know it's failure. It will be another ANC failure. So if my question is, or our question is, if a first world country can't sort this out, just imagine the ANC with their track record of corruption. They are just in it so they can gain. They can gain from it. That is the view we are taking because just just imagine we should trust anything the ANC is saying, and implementation is their biggest struggle. They cannot. They only implement. They only change things. They don't build things. Now we are gonna waste another 8.8 billion within the next 3 years. I don't think we should agree on this.
Look, I think there is a bit of a light at the end of the tunnel. I hope so. With the Freedom Front Plus threatening the government with court action if the bill is passed. The EFF has also gone on to say that they don't support the NHI because the government doesn't have its house in order. That is encouraging as well. Not that I am a supporter of the EFF, but it's encouraging to hear opposition parties slamming the bill. The IFP has gone on to say that hospitals and clinics were already stretched to the limit. There aren't doctors and nurses in the public health facilities. So, how on earth are we going to get this right? Ismail.
That's exactly the question. That's exactly the question on everybody's mind, everybody's tongue. With the failing healthcare system, government, I you know what? We've just heard what the Freedom Front said, the opposition, the EFF, the DA is even complaining about it. But I'm just saying, with the crumbling health infrastructure system we're currently faced with, I mean, now you're looking at the medical aid schemes. Government is saying eventually it will fade away. But now here's a question: like people, kids with ADHD, right? All of
Mm,
those symptoms. We've got people that are due for operations within 3 years from now, and the government cannot even cope with it. Some operations have been, you know what, neglected. They make mistakes. Look at the claims against the health system,
mm.
a crumbling health system, and the ANC. I want to mention again the ANC stating they would get it right. Look what happened to during COVID-19. Look at the corruption with the Guptas as opposition parties. We will always complain, but the ANC will basically implement their strategy because those hyenas have seen the 8.8 billion and they just want to eat it. Plain down.
I can't agree with you more. It's really a very, very worrying situation. Though we are hearing from experts, economists, etc., suggesting that don't panic just yet because implementation, if it does get to the point of implementation, is going to take at least another 5 years. And lots can happen in that time. There's also the very big question about if this does get implemented, we are going to have a huge brain drain in the country. Our doctors are going to be leaving, our healthcare professionals will be leaving because they will not be able to cope with the load.
Okay. My personal view on this: they say ethical leadership, right? And for this economy to flourish, here's my take on it. I'm sorry to jump from NHI to politics, but if we don't get rid of the ANC by 2024, like this will only be implemented 5 years from now. So
Mm.
I will agree with our economists. I'll agree with whoever says what, but this is just my personal take. If the ANC can be removed by 2024 and within 5 years time, this gets implemented and we have started to rebuild our country, maybe, just maybe, we might succeed. But the question is still there. Okay, the economists, they basically know what's, they predict into the future. They can see where we're heading to. But my question, our question, if a first world country can't get it right and they buckling, with our system, everything's being destroyed already. So it's a 8.8 billion to the healthcare system. What about infrastructure? And then we'll have excuse upon excuse. Just a clear statement. If we don't remove the ANC by 2024, this bill will be passed and they'll just eat the money and there's nothing we can do about it.
Well, currently the public health system is failing. We've heard so very many stories. Rahima Musa Hospital, the scandal there, Charlotte Maxeke, Tembisa Hospital, where they spent I don't know how many million rands on genes for children. Those were monies, taxpayers' monies, to buy upgrade medical facilities, hire more medical staff, and provide and provide medical services to the people that truly need it. And I think I'm going to wrap up by throwing out one more statement, and you can respond to it without being xenophobic. Without being xenophobic at all. If this bill were to be passed, can you imagine the influx of foreigners that will come to South Africa for the free medical care? Because those comments and those accusations have already been in the pipeline for a very, very long time. One of the reasons why we have a flare up of xenophobic activity is because locals feel that that services meant for locals are having to be shared with foreigners. And I'm sure that these feelings will be strengthened and is going to create more xenophobic unrest obviously in the townships and in the informal settlements.
On that question, it's not being xenophobic, but reality is reality. As I said at the beginning of this interview, call a spade a spade. And yet, we are failed state. South Africa is a failed state. Foreigners are in our country. Basically, it's now 50-50. On the same point, not being xenophobic, we are allowing foreigners to come into the country. Whenever something happens, it's no more the ANC to be blamed, it's the foreigners to be blamed. Now, just imagine with this bill being passed. Like you said, everybody will flock into this country. What will happen to the locals? I mean, people voting for this government. What's going to happen? Because basically, we'll have no leg to stand on. People will be coming, and obviously, with people giving out money for this, for people to help them, it will just increase crime. It will increase everything. I don't want to jump the gun and just blame. But I think it's up to us, South Africans, to make a stand. 2024 is our only hope for this country to be saved. And also, let it be noted, when we say the country to be saved, it will not just happen within 5 years, like this bill to be passed in 5 years. It's going to take some time for us to get back on our feet, ethical leadership, sort out the crime, sort out education, sort out the health system. All of those contributing factors towards 2024. We need to make the decisions. We need to go out there and vote. Encourage every young man, every person that has never voted, every person look at this bill, not just this bill, the equality bill that have just been introduced now in government 10 years ago, which they're signing off now. South Africa is in a mess. Unless we stand up and vote, nothing else will change because we'll be complaining. Opposition parties will basically just complain, but never get to see, us prosper as a country.
Ismail van Wyk, on that very negative note, I share your sentiments 101%. Let's see how this is going to play out. Undoubtedly, we're going to keep a very, very keen eye on the developments of this situation. Lots more discussions will be had with a whole host of role players regarding this matter. We'll be talking to doctors, to medical aid schemes, economists,
Mhm.
etc., and truly put together a picture for people to understand the impact of the NHI. But thank you indeed for your input on the show this morning. You go well. And as I understand, you are a community activist in Ward 68 in Riverlea. Keep on the good
That's correct.
work and salaam alaikum to you.
Walaikum salam. Thank you very much for this interview.
Pleasure.